Why is herniated disc pain worse at night? A herniated disc occurs when the disc inner nucleus pushes through a tear of the outer annulus. And what that means simply is that a disc has two main components, a center component and it has an outer component or a ring. And that center component can push through the outer component and start to affect and extend into areas of the spine that it shouldn't extend into. And the most common area it extends into is the surrounding areas that potentially could affect the nerves. So therefore, some people with disc herniations feel no pain because it's not affecting the nerve tissues in any negative way. So therefore, they experience nothing. So there's asymptomatic patients or patients that feel no pain walking around with disc herniations and they don't even know. While other patients can have disc herniations, they can find it very painful, in fact, almost debilitating. And it's when this disc herniates and when it becomes painful, it's when it mostly compress nearby nerve tissues. And this is the key because when it starts compressing nerve tissues, this is when the pain severity changes depending upon how much compression is occurring and where the compression is actually occurring, meaning it's occurring in the neck, in the mid-back, or the low back. Now, back pain around the herniated disc can be common because typically when there's a herniated disc, potentially it could be some other concerns and the muscles and tissues around that area could be affected, and therefore pain around the area of compression is common, but not always there. Now, the pain caused by nerve compression can be felt anywhere throughout the body. It could be sensed through the area, sensing right out into the area of the spine. It could be sensing down into the legs or into the arms, depending on where the herniated disc could potentially be. And this radiating pain can be felt into the hands and feet, and it could potentially feel like sharp shooting sensation. It could be numbness. It could be tingling. There could be associated related muscle weaknesses and spasms. And it can also potentially lead to some type of organ dysfunctions because these nerves, they control everything and they're responsible for every function in the body. Now, herniated disc can sometimes feel worse at night because what happens if once it starts to affect the nerve tissue, nerve pain or nerve pressure tends to be more sensitive at night. At night, when you're calming down and trying to sleep, your nerve system becomes more sensitive to things that it could potentially feel because you're trying to relax. The nerves become in a heightened state and you can potentially feel this pain more. And this is a result of the nerves being affected. If there was no nerve involvement with herniated discs, you potentially may not have an increased pain at night. Now, some patients, as they're laying there and they decompress these discs some, they may notice after a period of time that the pain may start decreasing. But initially, when they try to sleep, they notice that their nerve pain becomes more sensitive. They notice it more. So when we look at sleeping, what's potentially the best way to be sleeping if you actually have a herniated disc? Well, we always say whatever decreases the amount of pain you're experiencing with your herniated disc. So if it's on your side, then sleep on your side. If it's on your back, sleep on your back. There's no best way to sleep that's going to help disc or the herniated disc heal better. You just don't want to be in a position that's increasing the symptoms, because if you're in a position typically that's increasing your symptoms, typically you're causing more compression. And then that more compression normally is going to evolve to more problems with the nerve tissues that are exiting. So anything that can alleviate pressure. Many patients typically say like laying on their side with a pillow between their legs, keeping their hips square, maybe kind of holding a pillow so their torso doesn't rotate, tends to be the best. But honestly, I've seen it happen many different ways for many different patients over my years. So you find the position that's most comfortable for you. For general spinal alignment, we normally recommend sleeping on your back with very small pillows, not a very big pillow to keep your neck and body in a neutral alignment. But sometimes in that position, that may increase nerve pressure, so therefore you may want to turn to your side. The worst way to sleep for a spinal position is laying face down. Face down tends to be the worst because you have to twist and torque your neck the most to breathe properly, and that potentially could exacerbate any type of disc herniations in your cervical spine. Now, when we look for treatments of herniated discs, this is going to really be based on the severity what kind of symptoms you're experiencing as a result of the disc, and the potential causation where it's located. Now, it's common for non-surgical treatment for disc herniations, could things like chiropractic care, could be exercise therapy, rehabilitation, could be lifestyle modifications, and simply just rest can allow the body to heal and recover and sometimes bring some of these discs material back in. In more severe cases, there could be like pain medications, it can be injections, and there even is surgical treatment options for herniated discs, but those tend to be last resort types of options, or if the pain is so debilitating, you can't do conservative treatment. The best way to preserve disc health by far is to practice a spine-friendly lifestyle and deal with healthy activity level and weight management and having regular checkups for your spine, making sure your spine's in the right alignment. Normally, herniated discs are a result of abnormal alignment that goes uncorrected, and you get compressive forces that's going to cause these discs to bulge and eventually herniate. Here at the center, part of our treatment includes lifestyle assessment and looking at patients before potentially they have any issues, meaning like herniated disc. But if they've already developed it, we want to really modify their lifestyle and try to deal with the causation of the problem and the alignment that's associated potentially that's leading to this disc herniation. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.